So what exactly is a herniated disc and why does this cause me pain? The analogy that I like to use to describe to my patients is if I were to hold a jelly donut between my hands. My hands are the vertebrae and the jelly donut being the disc. And there's fluid inside that disc, which would be the jelly. As I move my hands forward and back, the jelly inside would move forward and back as well. Well, over time, or if you were to have an injury, there's wear and tear on this disc, and it could start to poke out the side. You have nerves all along the spine, and if this jelly, so to speak, were to touch that nerve, this is where you start to get your pain. It can be in the neck, it can be in the back, and depending on the symptoms, it can cause pain or numbness in your hands, pain across your back, pain down your leg. And Advantage Rehab, what we do is we bring in traction, lumbar traction or cervical traction, and by doing tests and evaluations, we can determine where this herniation is, and we will put you on traction, which allows us to open up the space where that herniation is occurring, which separates and takes the pressure off of that nerve. And during this process, there's healing that occurs and blood flow that comes in. And over a process of a few weeks, this eventually starts to heal itself without the need of surgery. After we use traction, we have a machine in our clinic that's called the ATM. And what we do with this is we belt you into the ATM, which provides maximum stabilization. So we're able to do exercising without movement, which can irritate the spine when you have a herniation. So this is what we do within our clinic, and this is why herniated disc causes you pain.